Coronavirus, 31 dead, elderly covered in feces at Dorval long-term care facility.
Here's a summary of the article.
Quebec Premier François Legault said Saturday that he believed there might have been gross negligence by management of a private long-term care facility in Montreal that has seen at least 31 deaths since March 13. The facility, Residence Heron in Dorval near Montreal's Trudeau Airport, is considered to be a luxury retirement home, with room for about 150 residents. On Saturday, Lynn McVeigh, the president and CEO of the Health and Social Services Centre in Montreal's West Island region, said health officials quickly determined, after they arrived, that the facility was short-staffed and would need support from other healthcare workers to help clean and feed the residents. McVeigh, from the Regional Health Authority, said that public officials weren't able to get all of the answers they needed and contact families because the owner of the facility refused to provide access to clinical files, until the government issued an order on April 8. So obviously, it's hard to be concerned about a long-term care facility that is hiding a situation. We thought there were a few cases, a few deaths that were confirmed, so we'll be following up. This isn't the first time complaints were raised about care provided by the Heron facility. The measures will include increased screening, prioritizing facilities that currently have outbreaks, and increasing support to healthcare workers.
This post received a score of 21,000, with an upvote ratio of 95%. Here are the top comments in response to this article.
If they're covered in feces, I think the problem goes way beyond coronavirus. I fear that's a problem in many countries that often gets swept under the carpet. IMO, no wonder, given the pay they earn. One of my greatest fears is to end up in such a place.
It's not just a pay issue. Most of these facilities are severely understaffed. One CNA can only do so much care in a 16-hour shift. When you're supposed to be assigned 12 residents per shift to care for but you're given 30 per shift, good quality care becomes nearly impossible. Each resident must be fed, bathed, gotten out of bed, vitals monitored, groomed, and sanitary briefs, adult diapers, changed at minimum 3 times per shift. That leaves these hardworking, underpaid, and understaffed CNAs about 10 minutes per resident to do all that work. It's impossible.
Try to do it with 12 bedridden, incontinent patients. Most have the added gift of dementia. Some are not pleasantly confused. They are probably some of the ones covered in feces. Some need to be repositioned every 2 hours. Some get dressed, a lot need to be fed. Now, add fever, cough and fear of your own infection.
I've done it. I did it for years until it became so corrupt and horrible that I quit because no matter how much I reported it, nothing changed. I couldn't look into those residents' eyes and know that I was powerless to truly help them. I did my best, I just couldn't be a part of it anymore.
I left the nursing home after 13 years of that bullshit. I work in a hospital now and get floated to the COVID floor a lot, but the change was worth it.
Can't believe you survived 13 years.
Staff are walking out of nursing homes. No PPE. They are scared to death. Leaving a few dedicated staff to care for way too many patients. Nursing homes should be the big story.
Nursing homes and jails and the CAFOS are all gonna be a problem this year. Confinement is a bitch that is going to slap us all up.
CAFOs have been a problem. Disrupting the nutrient loop and exacerbating fertilizer use, reliably flooding their poo lagoons if it's wet out, increasing the illnesses in the poorer regions that have to endure the atmospheric fecal dust.
Atmospheric fecal dust? This truly is a nightmare.
Big pollution problem in cities before the internal combustion engine. All the horse shit in the streets could dry up on hot days and be kicked up as dust by traffic.
I work in a care home with 28, most of the time all 28 plus 5 to 6 staff in one very large but one room. I'm thinking if COVID sneaks in we all fucked. I asked my manager if we should be wearing masks at all times, she said no. I asked if all residents to stay in their bedrooms, no. We surely a risk. I worry.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.